As a type 2 diabetic, you need to consider some things before starting 16-8 intermittent fasting. Can fasting help regulate sugar spikes and improve insulin sensitivity? Does it balance digestion or create imbalances? Will it speed up results or slow progress? Most importantly, how to do it right without risks. Hi, I'm Dr. Vikas Sangotra, and today's video will break it all down in simple, practical terms. If you're thinking about adding fasting to your diabetes diet, you won't want to miss this. Let's dive in. Type 2 diabetes in Ayurveda is associated with prameha, a disorder caused by imbalanced Agni digestive and metabolic fire. While initially a kapha dominant condition, it progresses through stages influenced by Pitta and Vata dosha, leading to impaired metabolic function, insulin resistance, inflammation, and tissue degeneration. So intermittent fasting or upavasa align with Ayurvedic principles as a langan karma, that is reduction therapy aiming to balance Agni and restore metabolic harmony. So before we dive in, I have something special for you. We are offering a personalized Ayurvedic health report that will uncover your unique body type Prakriti, your current imbalance of dosha, the ama level toxicity, and much more. It takes just a few minutes. Simply click the link in the description, fill out a short questionnaire, and get deep insight into your health based on Ayurveda. And the best part, is absolutely free. So try it today, try it now. So how intermittent fasting works in diabetes? Let's see step by step. There are many ways of doing intermittent fasting. 12 hours, 24 hours, 48 hours, 72 hours of fasting also. But here we are talking about one method, that is 16/8 method. Number one, it really helps in improving insulin sensitivity. Let's see how. Intermittent fasting directly helps in reducing insulin resistance, a hallmark of type 2 diabetes. So by restricting food intake of specific periods, the body's demand for insulin is temporarily reduced. This allows the cells to become more sensitive to insulin when food is reintroduced, improving the uptake of glucose from the bloodstream also. Over the time, intermittent fasting helps reduce the chronic elevation of blood sugar levels, restoring balance. Number two, how does it help in reducing blood sugar levels? So fasting reduces hyperglycemia by limiting the frequency of food intake, which prevents large blood sugar spikes. So during fasting, insulin levels naturally drop, signaling the body to burn stored fat for energy rather than relying on glucose. So this process helps stabilize blood sugar levels, especially between meals. Moreover, it enhances the body's ability to regulate your blood sugar after meals, mitigating fluctuations that are typical in diabetes. Number three is enhancing Agni at multiple levels. Intermittent fasting strengthens Jatra Agni, the gut digestion, Dhatu Agni, the tissue metabolism, and Bhuta Agni, cellular metabolism. A stronger digestive fire at all these three levels improves the conversion of food into essential nutrients, increasing the efficacy of a glucose metabolism. So this reduces the accumulation of ama, the toxicity in the body, supports tissue repair, making it easier for your body to manage glucose and reduce insulin resistance. Number four, intermittent fasting really helps in detoxification and improved channel flow. Fasting helps clear the channels, srotas responsible for the transportation of nutrients and waste product in the body. In the early kapha-dominant stages of diabetes, blocked channel contribute to poor sugar metabolism. By detoxifying the body with the help of intermittent fasting, it removes blockages and encourages proper glucose absorption, hence improving your insulin sensitivity and reducing the burden on the pancreas. Number five is reducing inflammation and Pitta imbalance. As diabetes progresses, Pitta, heat and inflammation can damage blood vessels, lead to poor circulation, increasing complications like diabetic retinopathy, nephropathy, So fasting helps regulate Pitta by reducing inflammatory markers in the body. This assists in controlling blood sugar and reducing the risk of long-term vascular damage caused by high glucose levels. Number 6 is preventing Vata-related complications. So Vata-related complication means in the later stages of diabetes, Vata being dry in nature, it causes degenerations, drying in the body. So tissue degeneration called Dhatu-Kshaya, leading to neuropathy and fatigue. Fasting really promotes rejuvenation by supporting the body's ability to repair itself. So it strengthens Agni, allows the tissue to better utilize nutrients, preventing nerve damage and reducing the risk of complications like muscle weakness and immunosuppression. So intermittent fasting acts as therapeutic tool for type 2 diabetic by addressing its underlying metabolic dysfunction at various levels. There is a key considerations for intermittent fasting and diabetes. First is hydration during fasting. Stay well hydrated with water, herbal teas, and other non-caloric beverages. Proper hydration supports detoxification during this process, digestion, and kidney function, so reducing the risk of complication. Second important key consideration is balanced nutrition. So during the eating window, focus on nutrient-dense food, rich in fiber, healthy fats, and protein. Avoid processed